Hello, I'm Dr. Imran. I'm a senior consultant and clinical lead in the Department of Emergency Medicine at Star Hospitals. Today I'm going to be talking to you about a topic that has made a lot of news recently, and that is exercise-induced cardiac arrest. You might have heard in the news about people who have gone to the gym or are running and have collapsed and gone into cardiac arrest. Now, cardiac arrest is when your heart suddenly stops beating. And what is the relationship between exercise and cardiac arrest? So largely there's a misconception that exercise causes cardiac arrest. Exercise, in fact, is very good for your heart. And it is recommended that everyone does at least 30 minutes of exercise a day to keep a healthy heart. So what are some tips that you can take, you can adopt when you're starting a new exercise program? So first of all, if you have any pre-existing heart disease, so if you've had any heart problems previously, or if you have a family history of sudden cardiac arrest, or you have significant medical problems like high blood pressure, diabetes, and if you want to start a new exercise program, it's always good to consult your doctor before starting the program. Speak to your doctor, make sure you're on the right medications before you start a program. So that's the first thing I want you to remember. The second important point is when you start an exercise program, start slowly and then slowly build up as your stamina increases. Like everything, everything should be done in moderation, and exercise is the same. So don't go into sudden intense exercise when you're not used to exercising. So take your time, start with walking, and then you can slowly build up over a period of time. So that's the second thing I would like you to remember. The third thing I would like you to remember is if you've started exercising and you develop any symptoms, if you start to feel any pain in your chest, or if you start to feel short of breath, you have some trouble breathing, or you feel like your heart is beating really fast, the first thing to do is to stop exercising, sit down, and ask for help from people nearby. So these are three very important things that you should remember when you're starting a new exercise program. So if you have any pre-existing disease, make sure you consult your doctor. Start slowly and then build up. And if you have any symptoms, you need to stop immediately and ask for help. Also, if you're joining a gym, inquire whether the gym personnel have the ability to develop basic life support in case cardiac arrest were to happen. So these are some things that we overlook but are equally important. Here at Star Hospitals, we have a fully dedicated team in the emergency department with 24-hour consultant cover. We do lots of outreach programs where we go into communities and teach people how to do CPR, basic life support. So in an emergency, you would know that you're in safe hands when you come to Star Hospitals.